Tawan Willis of Los Angeles is just 30 years old, but soon he'll have a hip replacement, the result of sickle cell disease. About 100,000 people in the United States have sickle cell. You can inherit it if both your parents have the gene, but
it's not evenly dispersed in all populations. It tends to be more common in communities of African descent and communities of Hispanic or Latino descent.
With sickle cell, normally round blood cells are sickle or curve-shaped. They get stuck in small blood vessels and hinder blood and oxygen flow. Strokes, immune deficiencies, vision damage, infection, swelling, bone disorders, and pain can result. For Tawan, his hip isn't the only thing that hurts.
It started anywhere from my back, my shoulder, sometimes my leg. It just pains different places all over.
There are 6,000 or 7,000 patients in the state of California with sickle cell, and 51% of them live in LA County. So that's why we set up this clinic.
This new sickle cell clinic combines all services in one location. That way patients get the best comprehensive care possible.
At this clinic, the hematologist, nurse practitioner, community health personnel, and others all work together. It's not just good for patients, it's good for cost. The clinic ensures patients aren't undertreated, treated in the ER, or overtreated. In one instance, a patient was being treated with transfusions of normal red blood cells, but
she had liver failure and a liver transplant from just too many transfusions without pulling out some of that extra iron. So we really saw, a number of adults who were definitely not being treated as best they could be.
With the new sickle cell clinic operating for about a year, they're thinking this comprehensive approach could translate to other patient groups.
The next two ideas that we had were for adults with congestive heart failure, to combine cardiology and primary care.
And a cognitive care clinic for adults with dementia. In the meantime, sickle cell, even in a combined care setting, remains a complex disease to treat. But there's hope. Just this summer, the Food and Drug Administration approved a new sickle cell treatment, the drug Endari, developed by LA Biomed at Harbor UCLA Medical Center. For Tawan Willis, that could be good, but he's urging them onward.
Well, I hope they come up with a cure, because right now there's no cure for sickle cell.
Reporting in Los Angeles, Barbara Sharp.